Hello, I'm BMillzebub, and welcome to my channel and a new sex ed video. It's been a long while since I've done one of these, but today we're going to be talking about prostates, what they do, how to take care of them, and what can go wrong with them. But before we get into the video, I need to give a disclaimer. I am not a medical professional. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Since I'm sure some of the people out there who've clicked on this video don't know what the prostate is or what it does, that seems to be the best place to start before getting into anything else. The prostate is about the size and shape of a walnut earlier on in life and is below the bladder but in front of the rectum and surrounds some of the urethra. What it does is to help make some of the fluid, your semen, which is what carries your sperm from to your testicles during ejaculation. Sounds like a pretty critical part of having powerful and good feeling orgasms. But what I'm sure many of you out there do know about the prostate is that it can grow over time, but this growth is normal and to be expected. Like I said earlier, the prostate starts out roughly the size and shape of a walnut. By the time you're about 40 years old, it can reach about the size of an apricot. At my current age, in my mid-30s, I'm nearing this. And by 60, it can be about as big as a lemon. Something else you may have known going into this video is that an enlarged prostate can give you some difficulty with urinating. This is because that part of the prostate that surrounds your urethra is pressing on it, making it more difficult to pass urine from your body. However, this is unlikely to happen until you're about 50 years old at the earliest. This condition is called benign prostatic hyperplasia, or BHP for short, and the good news is it's not cancer. The bad news is it's common and can't be prevented. But for some context, WebMD has a few stats that may or may not give you some comfort. Some 8 out of every 10 men eventually develop an enlarged prostate. About 90% of men over the age of 85 will have BHP. About 30% of men will find their symptoms bothersome. I don't know how much that'll help everyone out there, but if nothing else, it tells you that you're not alone with this condition. Then there's prostatitis, which is an infection or inflammation of the prostate, which should not be confused with BHP, although the symptoms are similar. Prostatitis can affect you anywhere from your late teens, much earlier than BHP typically becomes an issue, and well into old age. Symptoms of prostatitis include trouble urinating, fever, chills, and sexual problems. Don't worry, the usual treatment for this is just antibiotics. We know how you get BHP, but how do you get prostatitis? Well, if you've had a catheter or some other type of medical equipment placed in your urethra, you've got a higher chance of contracting it. Or you could get it the fun way, and some STDs will cause an ongoing infection or inflammation. And then you've got the big C, cancer. Prostate cancer is pretty common with Americans who own and use a prostate. The risks of getting prostate cancer can be affected by some different variables. If you're 50 years old or older, you're at greater risk. In America, Black, Hispanic, and Native peoples experience a higher than average prostate cancer rate, while Asian Americans tend to experience the lowest rates of prostate cancer. If you have a family history of prostate cancer, that will also increase the likelihood that you have of getting it as well. And if your diet has a high fat content, that's not doing you any favors either. So now we've got some of the health risks for a prostate owning person. What about tests to be sure that the prostate is in good condition, or if you need to have a conversation with your doctor about prostate issues? I should say that your doctor will be performing these tests. They know what they're looking for, so it's probably best to let your doctor be the one to perform these tests. Of course, if you enjoy prostate stimulation, it's probably best to note that, if anything feels out of place or the norm for your prostate, and have a conversation with your doctor about it. But I've already kind of introduced the first test on the prostate, and that's the one that's feared by quite a few men, and that's the digital rectal exam. This is where your doctor will put on a glove and gently insert a finger into your rectum. And while they're rummaging about inside of you, there was probably a more delicate phrasing, but they'll be checking things like your prostate's size, shape, firmness, and any lumps, among other criteria they'll want to know about. There's a prostate-specific antigen test, which is a blood test that checks the amount of a protein called prostate-specific antigen, or PSA, that's produced by prostate cells. Higher levels of this protein could indicate, but is not necessarily proof of cancer. Then there's the prostate biopsy, which I personally think I would enjoy the least, because that's where they actually take a sample of your prostate. I don't like my skin getting nicked, let alone a piece of my insides being taken out. Given the different issues I just spoke about with prostate health and what tests may be used to see what, if anything, is wrong with your prostate, the next question becomes, how often should I get tested? Now, I'm going to say up front that your specific testing and treatment plan is going to be something you discuss with your doctor. So, what I'm about to talk about next is just sort of a general guideline for everybody, but I'm really kind of hammering on this one. Talk to your doctor. But the American Urological Association recommends that prostate owners age 55 to 69. All right, grow up, me. I've made it this far into a video about prostates without making too many uncouth jokes. But the American Urological Association recommends that prostate owners from 55 to 69 years of age who are considering screening should talk to their doctor and consider the risks and benefits and make a decision that best suits their needs. They do not, however, recommend testing for prostate owners who are 39 years old and younger, or ages 40 to 54, who only have an average chance of getting cancer. It should be mentioned that your chances of getting cancer should be a conversation between you and your doctor, not a decision you make with probably no medical training or experience. And as kind of a little extra piece of information, I looked up to see if Trans women needed to have their prostate removed, and I don't think, like, I couldn't find anything that said they ever would, because it could potentially cause urinary issues. You could damage nerves, so they generally tend to leave the prostates in. So, how do you take care of your prostate? Indeed. Well, a healthy diet and regular exercise should do you a whole lot of good, according to Harvard Health. To give you an idea of what a healthy diet looks like, Harvard Health suggested at least 5 servings of fruits and veggies a day, whole grain bread, pastas, and cereal, limiting eating red meat and eating eggs, fish, skinless poultry, beans, and eggs instead. Choose healthy fats such as olive oil, nuts, and avocados. Avoid sugar sweetened drinks. Instead of drinking them regularly, treat them more like treats. Cut down on the salt and watch your portion sizes. Really, those suggestions could work equally well for just being generally more healthy. As for the exercise, even something as simple as walking regularly at a moderate pace has yielded positive results in reducing prostate issues. This also sounds like another good way to stay healthy generally, not just to keep a healthy prostate. That's going to do it for this one. Hopefully you found the video informative. If you did, please leave it a like, subscribe to my channel if you haven't already, and click the notification bell to get notified every time I upload a new video. If you feel so inclined to help me out, consider supporting me on Patreon. And if you subscribe to the $5 a month tier, you'll be able to see most videos 2 days before they get released publicly. Or consider getting me something from my Amazon wish list. Every little bit helps, and every little bit is greatly appreciated. And click on the link tree in the description to follow my other social medias, including my YouTube channels. That's going to do it for this one, though. Take it easy, everyone, and I'll see you all in the next one.